face during this root canal treatment procedure. And we have two techniques related to the intraoral radiograph, either the paralleling technique, which is more accurate, and the bisecting technique. So in the last few years, we used to have the conventional X-ray films. And as you can see, these films already are very, very expensive. So you are going to tell me that the sensor is not expensive. I'm telling you, yes, the sensor is not, or the digital radiography is not expensive. And 6, we already have 4 steps that we need to take the pre-apical X-rays, which are pre-optive X-ray, working length determination, master cone X-ray, and post-optive X-ray. But actually, the situation is not like this. You should take at least 2 X-rays for each step, one with a paralleling technique and the other with a shift technique. So we are going to use 8 X-rays for each root canal treatment case. But if we are going to use an apex locator and an accurate apex locator with a repeatable and trustable reading, so we are going to skip the 2 X-rays for the working length determination. So the total will be 6 X-rays, 2 for the pre-optive X-ray, 2 for the master cone X-ray, and 2 for the post-optive X-ray. And please, please don't forget the follow-up X-ray. The follow-up X-ray should be taken after 2 or 3 months, whatever the case. So the pre-apical radiographs or the pre-apical X-rays, they are the most commonly used imaging technique in our practice. And as you can see here, I used it in such a case with curved anatomy. And here is the pre-optive X-ray. Here is the working length determination. Here is the master apical file on the working length. And I didn't take master cone X-ray here. And this is the post-optive X-ray. Look at the double curvatures and look at every detail. It's just precise and accurate on the X-ray. So we are implementing the digital radiography now in our daily routine instead of the conventional radiography. And for your knowledge and for your info, you should be aware that when you apply the digital radiography in your daily practice, you are just increasing the performance and increasing the quality of your root canal treatment, because the advantages of digital radiography are so many. So let's discuss these advantages together, starting by the elimination of the X-ray films processing. No need to process the film, developer, fixer, and sometimes you do over-developing or over-fixation. You cannot see clearly the X-ray, so you have to do a remake for the X-ray, and this will be very costly. So now this is the second which leads us to the second advantage of the digital radiography, which is being a cost-effective and more economic, having a significant reduction in the exposure time and the dose, and also to have an instant and high-resolution image display. Not to mention that this image can be enhanced by the software enhancement tools, and you can modify this image according to your preference. So it's very time-saving and having less effort for you and for the patient. Also, you are going to have a large database for the patients and doing archiving for the files and images transmission if you want to communicate with other doctors. And of course, when you reduce the radiation exposure, you're protecting the patient, protecting yourself on the long term. And it acts as a very good educational tool for the patient. And as I mentioned already before, the image enhancement tools by the software. Remember these films, conventional films, when we used to have removing the aluminum foil and then to remove the carbon paper and then to start processing. So you are taking time, you are doing some effort, which can all be eliminated if you have the digital radiography, or if you have the X-ray sensor, or if you have the eye sensor by Woodpecker. And of course, the X-ray just pops up on the screen and you can see it instantly. And you can just modify it with software enhancement tools as mentioned before. You don't have to take many X-rays. So if you have an X-ray and you need to modify something, you are going to modify it and not going to do a remake or a retake. So this will be a very cost-effective and more economic. Also, you are not paying for the fixer or the developer. So it's very cost-effective on the long term. and having a very significant reduction in the exposure dose, which will be a very protection step for you and for the patient on the long term. And as we all know that the mean dose reduction when using digital sensors like eye sensor from woodpecker is 55 to 70% compared with the conventional films. And now I'm going to show you some of the software enhancement tools by eye sensor from woodpecker. As you can see here in this video, I'm trying to modify the contrast of the X-ray, either to decrease or increase the contrast. For your info, I'm just filming by my mobile the screen of the computer in order to show you all the screen. Also, here is the brightness. As you can see, I'm just increasing and decreasing the brightness according to my preference and according to the quality of the image that I need in order to see all the fine details in the X-ray. Let's see this video together again. As you can see here, when I modified the brightness, I can see all the fine details, and this is only one function. So if you modify the brightness with the contrast, with the exposure, with everything, with the high definition, you're going to get a very clearer image. And here I'm going to play with the sharpness tool. As you can see, you can get all the sharp and fine details on the X-ray. Now, this is one of the most important tools I have in the Woodpecker software enhancement tool, which is the gamma button. As you can see, for the gamma button, you can get a very clear image. Let's see this video again because I really like this video. This is the regular image I received instantly. And this is after playing with the gamma. You can see all the fine details. So it can give you an accurate image of what you have done or what you want to diagnose. What about the coloring effect? This is also one of the enhancement tools. This is the coloring effect in order you can see the obturation material differentiated from the root and differentiated bone. See it again. Here's, I'm just going to pause. Here is the obturation material, the gataperca, and here is the root, as you can see, and here is the bone. So it can give you a very clear image about the quality of the root canal treatment. And sometimes we want to play with the invert button, so you can get a more clearer image like this one. If you pay attention now, this is a button which is called enhancement. And this button will help you to enhance the image. As you can see, the bone here is totally enhanced, and you can see clearly the lamina dura all around. See it again. Here I'm just playing with the enhancement button, and I'm going to sharpen all the lamina dura, as you can see, and you can see the bone very clearly. So all these enhancement tools, they are not present in the conventional radiographs. And if you want to get a very clear image like this one, you have to use the digital radiography. This is the high definition icon, which helps you to get a more high resolution, high definition image, as you can see here. So sometimes when you take already a periapical X-ray and you didn't do a good setting for the exposure time or the exposure dose, so you can just play with a high definition icon, which will help you to get a more high resolution and higher quality image directly from the software, and no need to do any retakes for the X-ray, as you can see here, just by pressing one button. And actually, this high definition icon is one of the most important enhancement tools you can find in the Woodpecker eye sensor software. So this is just an overview for the software, either from the zooming button, rotating, I'm just playing here with all. This is a flip horizontal or flip vertical. Playing with the brightness, sharpness, gamma. And as you can see, when we switch it to the gamma, we can see very clearly the inferior alveolar canal. We can see the gutta-perca flushing with the root apex, having a very minute cedar puff. So we can see everything. This is the magnifier tool, which helps you to magnify and see more clearer data. Coloring. High definition, and the H, the higher high definition. So what I'm going to tell you is that you don't need to take many X-rays in order to have a good and clear image. You can just take one X-ray, and if it's not clear due to any factor, you can just play with the enhancement tools, and you are going to get a very clear and sharp image. Well, for the eye sensor, we have two sizes. We have the size 1 and size 2. My personal preference is always size 2, and I'm going to discuss that later, because whenever I take an X-ray, I need to see the adjacent teeth. I need to see the full length of the tooth, including the crown, including the root, and a little higher part from the above the crown, and more apical part from the root. So in order, if I have an periapical lesion, for example, I can see the whole periapical lesion and to see a full picture of the tooth being treated. So that's why I always prefer to go for size 2 of eye sensor. So let's discuss what can we detect in the periapical X-rays, or by another means, what are the imaging functions. For example, if we are going to take an X-ray, what can we see in the X-ray? We are going to decide if the root canal, if the tooth is indicated for root canal treatment or not, or it's non-restaurable tooth and should be going for extraction. What are the size of pulp chamber? Is there any pulp stones or any very calcified canal? Do we have hypercementosis? Do we have condensing osteitis? Do we have internal or external root resorption? What are the number of roots? What are the number of root canals? What are the root curvatures or the canal's curvatures? Do we have a horizontal bone loss? And if we have, what's the amount of this horizontal bone loss? What about the bifurcation involvement? What about the size and the shape and the characteristics of the periapical lesions? And if we have a horizontal root fracture, what are the space between the two parts? And where is the site of the horizontal root fracture? And last but not least, which is the dental caries, we can see the site, the size, and the extension of the dental caries. If there is any root caries, are they extending on the root? Are they causing more caries on the root so that the tooth will be non-restorable afterwards? So all that we can check in the periapical X-ray. And as you can see here, I'm going to check the roots and the root canals morphology. As you can see here from this periapical X-ray, this is the preoperative X-ray for the upper molar.